Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Scheme as it drives Nigeria towards universal health coverage. In a bid to give affordable and accessible healthcare to Nigerians, the NHIS recognized that there is a certain percentage of the population that cannot afford to pay premiums for themselves or their family members. In response to this, the federal government put certain funds were housed in the NHIS to cater for them. This fund is what is known as the Basic Healthcare Provision Fund. Our program this evening explains this important program, which is a gateway to health insurance for the poor and vulnerable. Why don't you stay tuned for the rest of the program? I am Aisha Muhammad Ahmed, your anchor. Please don't go away.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlights of events around the NHIS. In the news, NHIS trains healthcare providers in Kaduna State on the implementation of Gift Ship N. Stay tuned for details of these and more shortly.
The NHIS on 19th May organized a one-day orientation and capacity building workshop for selected healthcare providers on its new package, Gift Ship N in Kaduna. The Gift Ship N program is designed to provide health insurance cover for National Youth Service Corps members so that all serving Corps members can have access to adequate and quality healthcare services.
A very special one.
The Zonal Director, Northwest, Khairi Sada, in her welcome address, highlighted some of the numerous packages designed by the NHIS for its enrollees. She asked the healthcare providers to equip themselves with the knowledge of understanding the different packages and how to treat them accordingly.
Several programs have been developed, fine-tuned. The Gift Ship is our flagship program, and I therefore recommend, or I therefore take this workshop as a very special one. It is special because it is the first time that we are bringing you all as stakeholders together, healthcare providers, on to enlighten you or sensitize you or bring you up on the Gift Ship and program, that is group, individual, family, social health insurance program for the NYS. Now this is designed, developed to cover the NYSC members across the country. It is worthy to note that the Gift Ship program is categorized into Gift Ship G, which is Gift Ship General, Gift Ship C, which is Gift Ship Constituency, Gift Ship R, that's Gift Ship for retirees, Gift Ship N, which is Gift Ship for NYS.
Nanzaria Jafaru, coordinator of the NHIS Kaduna State Office, gave an overview of the Gift Ship N and some of the operational guidelines the healthcare providers need to acquaint themselves with in order to upgrade their facilities for the attainment of the objectives of the Gift Ship N program. He also explained some of the modalities put in place to tackle the challenges under the program.
Actually, the NHIS made sure that 3 primary care centers were chosen from each local government, from which corpus can choose from. They can register with them and start assessing care. So we find it convenient that the facilities should also be on the same page with our mission and objective of this program. And that is why we said, let us bring this in charge of these hospitals. Let us train them. Let them show them how they are going to operate this program. How are they going to make claims for services rendered? And what does it entail? And that's exactly what we taught them today.
It was a very comprehensive training, at the end of which participants commended the introduction of the Gift Ship N program.
I've gained a lot I've gained, and I know what to do when I get back to my local government, my area of assignment. I know what to do. I will step down training for my fellow colleagues. Yeah, but nobody should send any youth copper away now. Anytime they come to the facility, we should give them, we should render the best we could for them.
We don't want to leave these youth corpus behind, and that is why they are included in this program. The way we used to do for basic healthcare or customer program is the same service we are going to provide for these people. So, and that is why they organize this program for selected 3 PHC at each local government, and that's why we are here.
Dr. Obakar Musa, Executive Secretary, Gombe State Contributory Health Management Agency, Go Health, called on residents to get enrolled into the health insurance program in order to avoid out-of-pocket expenses. He was speaking at a one-day orientation workshop for journalists on the Go Health activities in Gombe. He said the scheme is here to ensure that residents of the state have access to quality healthcare services at an affordable cost. Dr. Musa further said Go Health is well positioned to actualize the dreams of Governor Muhammadu Inuwa Yahaya in attaining universal health coverage.
Welcome back. The Basic Healthcare Provision Fund is a program designed to bring health insurance to Nigerians, especially the unreached and the vulnerable who cannot afford health insurance premium packages. Because beneficiaries are mostly in the informal sector, the program is under the Informal Sector Department of the NHIS. We spoke to pharmacist Chinyere Nduaka, who heads the department, and he explained some fundamental details about the Basic Healthcare Provision Fund program. Let us get the details.
Easy access to quality healthcare for all. NHIS.
In a bid to achieve universal coverage, the federal government created 4 gateway programs that will help meet the needs of the unreached. One of it is the NHIS gateway of the Basic Healthcare Provision Fund. The Basic Healthcare Provision Fund ensures the provision of basic minimum package of health services through the National Health Insurance Scheme. The program aims at strengthening the primary healthcare centers. It is implemented through the state's health insurance agencies who are close to the communities.
The Basic Healthcare Provision Fund, or BHCPF, is an earmarked fund meant to increase the fiscal space in funding of health insurance program towards achieving universal health coverage. It's money set aside to cover the indigent, the underserved, the less privileged in the society, whom ordinarily will not be able to afford the cost of premium in the society. So it's meant to expand coverage by paying for those who ordinarily will not be able to pay on their own.
The essence of this program cannot be overstressed.
We have a mandate to achieve universal health coverage, which means providing access to care for all Nigerians for the health care they need without any financial risk to them. The one key word there is for all Nigerians. That means for those who can pay, they pay. Those who cannot pay, someone pays for them. And in this circumstance, government has set aside some money to pay for those who cannot pay.
But how is the Basic Healthcare Provision Fund gateway implemented?
For the different gateways, they've developed framework for implementation. The NHIS further disburses its own allocation to the state health insurance agencies who do the direct implementation. The National Primary Healthcare Development Agency also does its disbursement to state primary healthcare development agencies. and the Emergency Medical Treatment Gateway is developing a framework that will be based on PPP, that is public-private partnership.
Just as the Basic Healthcare Provision Fund is being implemented, its inputs, processes and outputs is also being monitored at different levels so that its essence can be achieved.
The gateways have responsibility to monitor the implementation of this program by occasionally visiting and interfacing with the implementers, who are the state-based agencies. But overall, there is a governing body, both at the national and state level. At national, we call it Ministerial Oversight Committee, while at the state, we call it State Oversight Committee. They have oversight responsibility of also going into the field to see for themselves the level of implementation, and then find out if there are any challenges that needs to be addressed. That is on-site visitation, while like NHIS, that is the middleman transferring funds to the states, also carries out its monitoring activity and sends report to this Ministerial Oversight Committee that can use their own exercise to collaborate what they are getting from the scheme in terms of monitoring and evaluation activities over those state agencies.
To also ensure and monitor seamless implementation, the scheme recently held series of trainings across the country. These series of trainings were geared towards educating and building the capacity of personnel as they carry out this program.
As a new program, there is depth of information, at least at the subnational level. We realize that many of the staff of the state agencies do not have all the information and knowledge about the program. Besides the staff, we also realize that the board members of these agencies and then the State Oversight Committee do not know fully their responsibility. So it behoves on us to ensure that adequate knowledge is created at these levels to ensure efficiency in their activities very positively, because when everybody knows his or her role and everybody is abiding by it, the total outcome will certainly be greater efficiency in the system. Here, like I had said, we have targeted the implementers, workforce of the implementers, which are the state agencies. We've also imparted knowledge to the governing council to effectively deal with challenges associated with the program, as well as the State Oversight Committee, which is a larger body comprising of members drawn from all the gateways and then civil society organizations that represent the public, as well as officials of State Ministry of Health, all interfacing and deliberating over the implementation to ensure that maximum support is given in the course of that program.
The impact of the NHI's Basic Healthcare Provision Gateway on the healthcare delivery system cannot be overemphasized, as the implementers on the program say.
The Basic Healthcare Provision Fund, you have a marriage that is not that of convenience, which the marriage is practically inevitable, because there is a creation that says 45% of the fund will go to the National Primary Healthcare Development Agency Gateway, 50% to the National Health Insurance scheme gateway, and then the subnational levels, the state health insurance schemes, will administer that fund on behalf of the national health insurance scheme in the various states. So you now realize that with this kind of creation, like Basic Healthcare Provision Fund, that relationship becomes even stronger. So we collaborate actively a lot on ensuring that our people get the best.
When the Basic Healthcare Provision Fund was brought to the table, there was a lot of issues because there was no stakeholder integration, there was no inclusivity in the development of the manual, so it could not be operated very well. But with health insurance under one roof, we are speaking together with the ES, NHIS, the state, CEOs are working together. We're able to look at the manual, see the areas of the manual that cannot be operated, improve on them. In fact, we just finished another meeting now where we're looking at the implementation protocol of our gateway of the Basic Healthcare Provision Fund, and we have identified areas where we need to improve on whatever is captured for enhanced, successful operation of the scheme.
The NHIS, through its various gateway programs, is leaving no one behind as it marches towards attaining its mandate of achieving universal healthcare coverage by the year 2030.
The program Easy Access continues with our stakeholders segment, and this evening we shall be talking with the head of the Kano branch of HCL International, a health maintenance organization. HCL International has been in the business of health insurance for decades and runs several programs. According to Aisha Bajesun, NHIS is an initiative that can help strengthen the nation's healthcare system.
The health system in Nigeria is actually poor, if we want to say, but with scheme like this, we can get to where we want so that people don't have to travel out to get health care. NHI is a beautiful scheme because, like I said, to achieve universal health coverage, that's the only way we can go about it, because nobody can bring out money now and say, let me just go to the hospital. It's very expensive. So in order not to stress people and to diminish out-of-pocket expenses, the best way to go about it is through the National Health Insurance Scheme.
Aisha speaks further on the impact of the NHIS scheme in Nigeria.
Well, the NHIS truly is a wonderful scheme if only it can trickle down to the grassroots. It will really help. Just imagine if everybody in the country need to pay just 500 naira per month. That's a large sum of money. If we're able to pull that resources together, I think we can use it to carry our healthcare to the next level. So if HMOs can market these products that NHIS have and people key into it, it will be a wonderful idea to the NHIS.
Aisha also gives the perspective of HCL International as a partner with the NHIS.
We started partnering with NHIS right from inception, that is in 2005. We're one of the initial HMOs that were registered under the scheme, HMO 004. So, and my perception about the scheme is that, you see, accessibility, some people that registered under the scheme couldn't afford to do some form of surgeries or things like that. But with this scheme, they are able to do that. They are not only accessing government-owned hospitals, they are also accessing private facilities where they can go and get whatever they need to be, whatever service they request for to be done. What we do is that we serve as intermediaries between the NHIS, who are our regulators, the enrollees, and the hospitals. So basically, what we do is that we carry out NHIS functions. So just like the way the banks carry out the functions of the CBN to the population, we make payments to the hospitals, timely payments to the hospitals on capitation and fee for service. We do referrals, timely referrals. We make payments to, we make sure we do quality assurance to the hospitals, and we do sensitizations to enrollees, and we market the health insurance to the populace too.
On the partnership between the health maintenance organizations and the healthcare providers, Aisha offers this explanation.
Even the teeth and the tongue quarrel. So I cannot say it's 100% rosy. Yes, we have issues with them, especially when it comes to payments. So, but we usually sit down, reconcile, and verify, and pay them their money for any outstanding claims they say we're owing them. So it's not bad, but it can be better.
Aisha further commends the introduction of the NHIS reconciliation exercise between the health maintenance organizations and the healthcare providers, as it has helped to address many issues.
That's a beautiful idea that the NHS introduced, because the hospitals are able to get most of their claims out, and then relationship is strengthened between the NHIS, the HMO, and the hospitals, and the scheme runs as should be, because nobody will want to run on a loss. So the scheme, the reconciliation, is a very good thing in ensuring that payments are made to the hospitals by HMOs.
In conclusion, Aisha suggests ways that will help the scheme achieve its mandates.
I will plead to them that they should make sure this scheme spreads, awareness is made, is better than what it is, and more people key into the scheme. All sectors in the country need to be able to access this scheme for us to have the universal health care coverage. Without it, if we don't spread, I'm sorry, the scheme might just be for a particular set of people. But if awareness is made better and the scheme is more IT savvy, and the layman on the road can easily register and enjoy this scheme, even though there is the gift ship program which they rolled out recently, but it's been on for a while. It's just that the name was changed, and people key into it and all. It will help achieve the universal health coverage.
That was Aisha Badison sharing her thoughts as a stakeholder in the health insurance space. Up next, your questions answered. Please keep watching.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
Question: if I am single, can my children benefit from my contributions?
Definitely. Your children, once they are biological, it doesn't matter. I mean, we don't decide whether you are married or single. The basis is that you are actually a contributor under the health insurance system, and we can verify that the children that you are registering are your biological children, or whether biological or adopted, as long as we have proof that they are your children.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
I think I paid almost nothing.
In Wait Easy, we only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
And And so, we draw the curtains on this week's episode of the program. We all have a responsibility in helping Nigeria attain universal health coverage by keying into the NHIS and letting more Nigerians know that they can enjoy social health insurance, especially the vulnerable, as it has been paid for by the government. Find out how and get them enrolled too. See you next week.